and welcome to today's topic, Agonist, Antagonist and other related terminologies. Agonist. Agonist is a substance that binds to the receptor and produces a response. It has both affinity and intrinsic activity. For example, adrenaline is an agonist at adrenergic receptors. Antagonist. Antagonist is a substance that binds to the receptor and prevents the action of the agonist on the receptor. It has affinity but no intrinsic activity. For example, tubocurarine is an antagonist at nicotinic receptors. Partial agonist. Partial agonist binds to the receptor but it has low intrinsic activity. For example, pentazocine is a partial agonist at the opioid receptors. Inverse agonist. Inverse agonist activates a receptor to produce an effect in the opposite direction to that of an agonist. For example, diazepam acting on the benzodiazepine receptors produce sedation, anxiolysis, muscle relaxation, and controls convulsions. While in inverse agonists like beta-carbolins bind to the same receptors, the BZD receptors, to cause arousal, anxiety, increased muscle tone, and convulsions, opposite to the action of the diazepam. Comparing agonist, antagonist, partial agonist and the inverse agonist. An agonist is a substance that binds to the receptor and produces a response, while an antagonist is a substance that binds to the receptor and prevents the action of the agonist on the receptor. Partial and the inverse agonist. Partial agonist binds to the receptor but has low intrinsic activity, while an inverse agonist activates the receptor, produces an effect in the opposite direction to the agonist. Agonist has both affinity and intrinsic activity, while antagonist does not possess intrinsic activity, while partial agonist has low intrinsic activity, while inverse agonist has negative intrinsic activity. To conclude, there are so many beautiful reasons to be happy. Let's get rid of the negativity. Thank you.